Hi, this is Madison. I'll be talking about the pancreas and alpha cells and beta cells. Alpha cells elevate glucose levels. Beta cells produce and release insulin, a hormone which reduces blood glucose levels. Beta cells respond quickly to spikes in blood glucose concentrations by sending some of their stored insulin while simultaneously producing more. The pancreas helps with blood sugar control. Cells within the pancreas help to maintain blood sugar levels at homeostasis. The cells that do this are located in the pancreas, alpha and beta cells. When blood glucose levels are too low, alpha cells secrete glycogen, which increases blood glucose levels. When blood glucose levels are too high, beta cells secrete insulin to decrease glucose levels in the blood.
Hi, I'm Noah Robinson, and I will be talking about type 1 diabetes. When a patient has diabetes type 1, this means the pancreas is not releasing enough insulin to control blood sugar. This is mainly because the body attacks the beta cells, which then leads to less insulin being produced and released. This normally occurs in children, but adults can be diagnosed with this disease as well. Symptoms include increased thirst, frequent urination, extreme hunger, weight loss, weakness, blurred vision, and fatigue.
This is Taylor, and I will be talking about diabetes type 2. When a patient has diabetes type 2, this means that their body produces insulin and releases it, but there's too much that's not being used. This could be because the insulin receptors have weakened, the GLUT4 is not appearing to allow glucose in, or your body simply resists the insulin. If the insulin receptors are weak, then insulin cannot bind to them, therefore glucose cannot get into the blood cells. Symptoms include increased thirst, frequent urination, extreme hunger, weight loss, fatigue, weakness, blurred vision, and numbness in hands and feet. Treatments for both type 2 and type 1 diabetes are insulin injections, diet, and exercising.
So here's a demonstration. We have the insulin that binds to the insulin receptor, letting all the GLUT4s in the cell know to let the glucose in. So when someone has type 1, they don't have enough of these, so none of the GLUT4s inside the cell can open this to let the glucose in. And then with type 2, there's a normal amount of insulin, but the GLUT4 ignores the insulin, so the glucose isn't let in. Then we also have a diagram of a bloodstream and all the blood cells and then the glucose and insulin going through the bloodstream. And then we have a person and food or glucose going down to the stomach. And then we have the pancreas that has all the insulin made from the beta cells.
And when the insulin is released into the bloodstream, the blood cells then let out the insulin receptors for the hormone to be binded with them. Therefore, the GLUT4 will appear and allow glucose into the blood cells for energy.